Welcome everyone. My name is Yi and I'm your host for Occupational Medicine Pearls podcast. In this episode, I will cover about fluoride for clinicians and occupational health professionals who has to manage this dangerous chemical in the workplaces. I will cover the essentials, the chemistry, common workplace sources, how fluoride behaves in human body, clinical features of exposure, health surveillance, and how to monitor ongoing health assessments. Let's start. Fluorine is a pale yellow gas at normal temperature with an odor similar to ozone. It is extremely reactive. When it is combined with hydrogen, it may burn or explode when exposed to it. Due to its reactivity, fluorine gas rarely occurs in nature, and with fluoride ion more commonly found in the workplaces. Metallic fluorides are solid with variable solubilities in water. Monovalent metals of the salts are fairly soluble. Divalent metals are sparingly soluble, and hydrogen fluoride is a reactive gas that readily dissolves in the water, and it reacts with glass and it is highly corrosive. Fluoride compounds are used across many sectors: aluminum smelting, glass etching, semiconductor manufacture, electroplating, and even some cleaning and polishing products. Hydrogen fluoride, as I mentioned, in particular is highly reactive and can cause severe local and systemic injuries. As an occupational health professionals, we may be called after a spill, a suspected overexposure, or when workers report respiratory or skin symptoms. Knowing the metabolism, the monitoring strategy, and the immediate clinical steps for HF exposure is of critical importance. Fluoride is also found in most foods, including tea and drinking water, as well as dental hygiene products. Therefore, exposure to fluorides can occur through diet, such as water, seafood, fish, mouthwash, dental products, cleaning or washing agents, and etching creams or solutions. Once we know the sources, we need to understand our exposure pathways and how it is metabolized in our body. Fluoride is absorbed through inhalation as the main route. Soluble fluoride compounds are rapidly absorbed through the lungs, and greater than 90% of the pulmonary absorption come from there. Or absorption follow a similar solubility-dependent pattern as well. Once absorbed, fluoride circulates in plasma and it is partly excreted in the urine. However, a significant fraction is deposited in bones and teeth where it can remain for years. That skeletal deposition is why chronic exposure leads to fluorisis. If we're looking at the excretion, urine is the main elimination route. Roughly 40% of the absorbed dose is excreted in urine. Plasma and soft tissue fluoride have a shorter half-life, on the order of hours, so that's very quick. But skeletal fluoride has a very long half-life, measured in years, so it could be from 8 to 20 years. Having that knowledge has helped us in the understanding on the biologic monitoring. Urinary fluoride rises quickly after exposure within about 2 hours and remain elevated for a few hours after exposure stops. That's why pre-shift and post-shift urine sampling is recommended approach. Pre-shift after at least 40 hours away from exposure gives an index of how much is deposited in the skeleton, and post-shift sample reflect recent exposure. If we have to remember the numbers, pre-shift value can be 2 mg per liter and post-shift could be 3 mg per liter. These levels are the action level, hence if a worker has higher level than that, we will need to do something about it. Background level in the non-exposed people are generally less than 1 mg per liter. After this, we will look at pre-employment assessment. When a worker is going to work in a workplace with fluoride exposure, we need to gather their medical history, dental and skeletal history, anything related to these situations, and baseline urinary fluoride has to be collected at least 40 hours away from the exposure. We don't routinely perform X-rays, however, pelvic and vertebral X-ray could be considered if there is a history of prior exposure or of clinical concern for fluorisis. When interpreting the urine fluoride levels, we need to bear in mind that there are factors that could affect its level. The level is influenced by the level of fluoride in the consumed food and drinking water, fluoride released during metabolism of some pharmaceutical or other industrial chemicals, and handling of some household products that may have fluoride-containing chemicals. We could also consider plasma fluoride level. However, currently it is not recommended due to technical difficulties with the analysis of the sample. Blood levels of fluoride are generally low, and with the potential for contamination to have greater impact on the results. Therefore, urinalysis method is preferred. When looking at the target organ effect or health effect, we can consider acute effect and chronic effect. With inhalation of vapor and fumes as the primary route, it would understandably affect skin, eyes, respiratory system, and although the skeletal fluorosis is an important side effect, it is not usually a concern in the acute stage. Fluoride can cause irritation of the respiratory tract, causing coughing and choking, and may even cause ulceration, hemorrhage of the pulmonary lining. Depending on the intensity and the concentration, nose bleeding, burning, and irritation of the nose and sinus areas could happen as well. On the skin, the liquid or vapor fluorides may cause severe irritation, severe burn, and it can cause medical emergencies. Similarly, it can cause permanent visual defects, and conjunctival irritation and lacrimation may happen. High dose exposure to fluoride may inhibit oxygen binding and blood clotting, so it can cause hyperkalemia and hypocalcemia in susceptible individuals that may cause cardiac arrhythmia and arrest. After all this through, it will affect the brain invariably. So symptoms such as headaches, tremors, muscle spasms, seizures could happen. With the chronic effect, we need to consider mostly the skeletal system, fluorosis, which include osteosclerosis, brittle bones, joint stiffness and weakness, anemia, weight loss, and discoloration of the teeth. For people who are inhaling the hydrogen fluoride for long term may experience pulmonary edema, tracheobronchitis, hemorrhagic alveolitis, and adult respiratory disease syndrome. So they are quite dangerous health conditions. From cancer perspective, fluoride has not been shown to cause cancer so far. I would like to summarize the episode again. Fluorides are different compounds that are released during the manufacturing process, and some of them are used directly for the assisting with the industry, such as hydrogen fluoride or hydrofluoric acid. They are highly corrosive, but their danger depending on the form and their concentration. So a healthcare provider will need to understand the nature of the hydrogen fluoride or any other fluoride compound that you are going to be dealing in the workplace you are assisting. If we are looking at the replacement medical, it is mostly to cover basic aspect. There is no specialist test other than collecting urine sample for the urinary fluoride. It is important to know the acute and chronic effects of the fluoride exposure. Thank you for listening today. If you found this episode useful, please subscribe on the Spotify or Apple, and please also share with your colleagues. Until next time.